The senator from Charleston, Senator Senn, what purpose do you rise?
Mr. President, to see if he would yield.
For a question? For a question.
Thank you, yes. With all due respect to the senator from Lexington, after she asked questions and then doesn't want us to ask questions, I do understand her point, but I did want to ask something in response to actually what Senator Shealy was asking. I remember, and I'm sure you do, listening to testimony, I think it was probably 3 or 4 years ago. I was not even on medical affairs, but I was interested and sat in and listened to a lot of pro and con testimony on this bill. And I do remember back then, some people from Arizona and maybe Colorado came and gave some stats and data about the people that were actually card holders in their area. And I wanted to follow up on that because I was pretty astonished. You tell me if you remember it like this, but I remember hearing that the overwhelming number of card holders were kids or people under the age of 25 who were claiming chronic pain. And I'm going to get onto this. Now I've got some new data in my hands. I'm looking at the 2021 Arizona Marijuana Active Card data from there. And therein, it says that of all the card holders in Arizona in 2021, 0.04% were Alzheimer's patients. 0.04. Are you aware of that?
In what state? I'm sorry.
Arizona, 2021. And I think it is probably unfair for me not to give you a copy of this. I will. But do you generally remember, and to your knowledge, does it generally hold true, that the overwhelming people who get these marijuana cards are claiming chronic pain, and many of them, the data in this particular thing says 30 and under. I remember hearing testimony it was 25 and under, but this appears that 94.2% are people under age 30 claiming chronic pain. So it's not the cancer patients and...
Well, let me respond to that if I can.
Yes, sir, sorry.
In two ways I would respond. First of all, this is South Carolina's law, and our universe of qualifying conditions is much more constrained than in other states. The second thing I would say is we do allow it to be used for chronic pain, but it has to be tied to a diagnosable and certified physical ailment or condition by a physician. So I can't speak to what might happen in other states because they have either loose definitions of qualifying conditions or if they've got loopholes. What I can tell you, Senator from Charleston, is I've drafted this language, and I guess now's a good time to go through it, with an eye toward not allowing it to be a farce, not allowing it to be gamed. I mean, and that's really earned me a lot of opponents who are for legalization, okay, because they say this is too tight. It places too high a bar to qualify. I don't apologize for that because this is something new. I think it's important that we proceed cautiously. I think it is something that is very important to give patients the option to help people like Margaret Richardson, but I want to err on the side of being cautious. So when statistics are cited about, well, this is what happened in Arizona or this is what happened in California or Colorado, I guess my only response back can be, that's a consequence of the law that they passed. I'm going to speak to what the law we got before us here is, because as we go through it, I think you're going to see it's even gotten tighter since when you were on medical. Are you still on medical affairs?
I'm on medical affairs now. Yeah, I was not then. I was just interested.
But I think, you know, and this is frustrating to me as well. You know, the Palmetto Family Council, you know, just put out a big Facebook ad talking about, you know, secondhand smoke, marijuana. You can't burn, you can't smoke in this bill.
Right.
It's like, it's frustrating to me that they didn't even bother to read the legislation before they send out flyers.
Right, but I've read it. You can eat gummies, you can eat brownies, you can have all sorts of edibles and oils.
There are certain edibles, and we'll talk about that, but there are also
and I do want to let you get to continuing on. So I'll just want to say that like everybody else in here, I appreciate your efforts. You came to me as well asking if you could satisfy my concerns. My concerns were, and I'm sure you'll remember, that I wanted a doctor to be able to definitively point to an objective medical illness, and not just an objective medical illness, an objective serious medical illness. And what I read in this legislation does not do that. It basically says that, you even say that law enforcement officers and all first responders automatically qualify if they want, because they would have come across some traumatic incidents. They don't have to prove that they've had a traumatic incident. Same with combat veterinarians. But anybody can go to the doctor and say, I've had a traumatic incident. And every single one of us in this world has had a traumatic incident. And the same would go with chronic pain. I can go to the doctor and tell him my knee hurts. I go back the next week, my knee's still hurting. It's been hurting for 6 years. I got chronic pain. So
one of the things I would say, Senator, is if you look at the definition of debilitating medical conditions, sub-item 13, that speaks to chronic pain, and reads as follows. It's not very long. Any chronic or debilitating disease or medical condition for which an opioid is currently or could be prescribed by a physician based on generally accepted standards of care, subject, however, to the requirements of Section 44, 53, 2080, A3, H, I, and 2, double I, as to a physician's attestation regarding objective proof of the etiology of the patient's pain or regarding the patient having been diagnosed with a specific medical condition or disease that causes the patient severe pain. So you can't just walk in and say, I got pain in my knee. A physician has to put down in writing and attest that that pain is tied to objective proof of the etiology of the patient's pain or regarding the patient having been diagnosed with a specific medical condition or disease that causes that pain. So you can't just walk in and say, I've got pain.
yeah, because let's just say, doctor, I have tripped and fallen on the playground and chasing after my child, and my knee has just bothered me ever since then. Okay, now you got something you can tie it to. And then you even have in here that fibromyalgia is something that they can tie chronic pain to. That in and of itself is a nebulous diagnosis. So I guess my concern, and I'll sit down so you can continue, is that these doctors are going to be supposedly prescribing marijuana for basically anything, because they can prescribe opioids for basically anything. We know that. That's why we're in a lawsuit.
But they can't, Senator. There's 13 specific conditions that a physician, and I might as well go through this whole physician thing now, because it's been brought up a couple times.
I'm going to let you go ahead and go through it. I want to thank you, though, for yielding to me.
Yes, ma'am. All right, so Section 44-53-2080 talks about the written certification form that a physician needs to fill out in order to authorize a patient to access cannabis as medicine. And I'm just going to go through the things that they have to attest to in writing. Looking at paragraph 3A and then following down from there. First, that the physician and patient have a bona fide physician-patient relationship as a prerequisite to any certification. And bona fide physician-patient relationship is a defined term which is in person, not a drive-by. It's got to be an actual meeting in which a physician makes a diagnosis, physical, in the presence of the patient, physical presence. B, that the physician has consulted the prescription drug monitoring program to review the patient's controlled substance prescription history and has documented such consultation in the patient's medical record. C, that the physician has conducted an in-person evaluation and collected relevant clinical history commensurate with the presentation of the patient prior to issuing a written certification. At a minimum, that evaluation must include the patient's history of present illness, social history, past medical and surgical history, alcohol and substance abuse history, family history with an emphasis on addiction, mental illness, or psychotic disorders, physical exam, and documentation of therapies with an adequate response. And let me start with that last.
Senator from Charleston, what
Yeah.
purpose? Point of order?
Point of order, yes, sir.
State your point.
It's very difficult for me to follow along when we're going paragraphs and things of that nature, and you're reading. And there are several sections in the bill where I recognize a lot of what you're reading, but is it possible for us to either go by page numbers or get something on the screen, or just we need to be able to stay together and understand what you're reading?
This one's, Senator Charleston, is Section 44-53-2080. I don't know what page that is on the screen.
I don't have there's not a point from that standpoint, but certainly made him.
Well, he's reading. If he's going to, he shouldn't be reading, I don't suppose. But I don't want to harm him.
Right.
I just want to be able to follow along.
I understand. So the Senate's so notified.